So I got Nina here right now, and this is probably the third time she's been under saddle, but it's always been in the round pen. So we decided to come out here into an open pasture just to get her a little bit more freedom and see how she does. And I got the barrel set up out here just to kind of walk around her, maybe trot, just trying to teach them to turn a little bit better. Walking and stuff, she's pretty good. She's still, you know, kind of unsure, but trying to get her to move a little bit has been a little bit of a struggle, but she's still a little young, so I don't want to push her too hard. Good job. Good job. Good job. Whoa. So I'm gonna let Peyton get on for a few minutes and see how she does. Peyton's an intermediate rider. I'm pretty confident that everything's gonna go very well right here. You gotta get that reach around and pull down a little bit further. Okay. That way she goes tighter around the barrel. Very nice. Disqualified.
You were so easy.
You did great.
So we're done with Nita, and now we're gonna go and untack her and hose her off, and then we're gonna go and work on our other horse.
So this is one of the kittens that Megan brought. She was with a foster. She had, I'm assuming, some kind of infection in her eye. She was on 2 different medications for a month to try and treat the infection. The medication didn't work, and so her eye got worse. I'm not sure exactly what caused it. We don't know, but the vets are going to check her out and see if her eye is able to be removed.
I'm estimating her to be about 9 weeks old. I don't know her name yet. She just showed up at Horse Plus. And her left eye is either already ruptured or on the verge of rupturing. And she is painful and visionless. So our indications for an enucleation, which is just removal of an eye, are an eye that can no longer see permanently and an eye that's painful. A blind eye that's not painful, we can leave in. But in this kitten's case, this eye, you can see how bad the swelling is. This could actually be a retrobulbar abscess. So Alex and I are both going to kind of come in here and do a little exam before we start. But the plan is to surgically remove the eye. Kittens do very, very well with this procedure. While we are doing a sterile drape and everything, we already know that this is going to be a contaminated procedure. Also, we need her to be able to breathe. So we're going to keep it as clean as we can, but also know that this is not going to be perfect. So Alex, go ahead and palpate. Sometimes an abscess will be really, really firm. Sometimes it will be super fluctuant.
There's definitely some pretty firm, but you know, not like bony firm.
Yeah. So I don't always approach these the exact same way. In this cat's case, my surgical plan is just to extend lateral canthus so we can see everything we're looking at, because we can suture that right back up.
And it seems like the lateral canthus seems to maybe be like the origin of her issues anyway.
I agree.
In this case.
So we could use a scalpel blade, or we could use our Metzenbaum scissors.
And is there like, I don't know, I'm kind of feeling like doing like reverse maybe?
You can do either way.
I don't know. Okay.
You also could take
like
your Metzenbaums and see if there's any chance you can lift up and slide that blade under there. That wouldn't be a wrong choice either. Yeah, look, I love that. Fantastic.
Work.
So not traditional for this, but I love it. And if you're not happy, you're okay, just cut through. You're gonna have some bleeding. Just do it.
And now I guess my Metzenbaums are gonna prevent me from going.
Yeah, beautiful.
Too far? You think that's good
I would
enough?
stop there and let's look at what we got. At least it was me and not you, right?
I mean,
so I just ruptured the eye. It was gonna happen. Yeah, okay. So most important thing about enucleation is We got to get everything infectious out, and we have to get everything that's going to cause a problem if we leave it in out, which includes a lot of our tissue, right? So we don't want to just remove our eyeball. We want to remove other stuff, and we're going to have to go on gas. So look how beautiful this is, you guys.
That is the most gorgeous lens I've ever seen.
It's beautiful. Wow. But the fact that it just popped out the anterior chamber tells us this eye was already.
Yeah, we're making the right call.
You're making the right call. This entire surgery, I'm so sorry, is going to be blunt dissection. And if it's helpful to have somebody hold stuff out of your way, ask for it. If not, be like, get out of my way.
It is helpful.
Great.
And then can I okay, I don't know, can you see this bit here? Like if I'm blunt can I snip it if I can see it really clearly?
You can snip it, you can blunt dissect it, go for it. And remember, you got to do this all the way around this eyeball.
All right, morning, Keith.
Morning.
What are we up to this morning?
We had a vehicle donated to us. I think it's probably over a year ago, maybe 2 years ago even. It's been a while ago. I don't know how long ago. I put a new radiator hose and stuff on it because it was leaking water and stuff. But it makes lots of noise, engine noise. So we're gonna load it up today on the car dolly, and we're taking it up to our it's the tech center up in Hohenwald, where students at the school get to work on things, and we're going to have them check it out and see if it's even worth fixing. So that's what we're doing today, at least this morning. We're only doing 8 miles an hour. You don't need to beep at me. It's not like we're flying down the road with no seatbelts. So.
Good work.
That's right. Keep it up.
Got this, man.
Tire needs air.
Well,
Keep it up.
We don't know how to do that. I don't know how to put air in a tire. Oh, I remember. Is the air compressor same place?
Same place.
Oh, you got it. You got knock me out. All the checks.
Both tires need it.
All tires.
There's a wasp nest somewhere, or a hornet's nest. Every time I open the door, oh, there they are.
Don't see that too often.
And it's been sitting for a while, so I kind of expected something somewhere. Let's see if it'll start.
There we go.
Thank you. The right key works every time. Too far.
There we go.
Wow. All right, she's all hooked up. And guess I'm ready to roll.
All right, sounds good. Guess we'll have to give him a warning.
Yeah, it's wanting to attack.
All right, thank
There
you.
you go, thank you.
I gotta go check my mailbox. We're gonna check the mail real quick. Somebody might have sent me a letter. Come on. Come on, good girl. Come on. Good girl. Could get a little bit closer, but. Nobody wrote me a letter, but it's okay, maybe tomorrow. Let's see if she'll let us go if we unlock this gate. This is Sego Lily. She's been here for a long time. And when I was an inmate here, she was completely wild. You couldn't touch her. She would shake and try to sit back. And here we are now. I've been sitting on her. She's laid back and chilled. I think she would really, really be an awesome kids pony. She is not a kids pony right now, but she will be. We take her on trail rides. We have done the obstacle course. I've taken her on multiple trail rides, and she's just does whatever I ask her to do. She's still a little skittish at times to people when they first walk up, but you can just jump on her. I do think she has an adoption appointment coming up this week, so fingers crossed. I would love to see her find a good home.
It's Mari from Horse Plus. I just want to say thank you so much for these awesome peaches. We've already had some people snagging some few, and they have been so good. They're so fresh and tasty. I love them, and I know everyone else is loving them, so we can't wait to eat them all up. And they were preserved very well, so they arrived in great condition, and we just want to say a huge thank you for donating them and keeping us all refreshed. So hope you have a wonderful day.
So Dr. Alex is going to be removing not just the eyeball itself, but the tissues surrounding the eye, which is a complicated lot of small muscles. I'm going to blot for you.
Thank you. Also very helpful.
Yep. So I would, yes, get in there and do some blunt dissection. Beautiful. Beautiful job.
There we go. That was a nice,
awesome
blunt dissection pop.
Visualize, you have to be able to pick this up high enough you can clamp everything behind it. Hold that in your brain.
This dorsomedial aspect is probably where we're most attached still.
So you're gonna take this guy and visualizing that you want the entire contents of your eyeball, you're gonna try to clamp optic nerve only, like optic nerve bundle in the back of the eye.
Try and feel it, or
Do
is
it.
her little
You
tiny
sure
eye
can.
socket too tiny?
You totally can. If her eye hadn't ruptured, there would be no way, but you totally can. And feel free to move it around as you're feeling. All right, now you're gonna take your scalpel blade and you're just gonna slide down along here and you're gonna try to get this whole eyeball without having tied anything off.
Okay.
I
mean, I've seen
some
it on
surgeries
horses, but...
you can just be aggressive with, and
There
so
we
you
go.
can't. Yay! So now you have to proclaim whether it's a girl or a boy, which is what I always do.
What do we think? I think it's real tough to call on this one.
I think so too. All right.
I think it's a girl.
I love it. So I think you got everything out of here. We left a little bit of tapetum lucidum. We're totally fine with that. I don't care.
Okay.
I need fresh margins because I can't just sew an eyeball closed, but I want to give myself lots of available space. So you're just going to gently, some people take a hemostat and clamp and slice. And some people hold it up and take your Metz and balms and cut along. There's really no right or wrong reason, but I like to try to be really intentional, this is a tough one, but if some cats have any remaining tearing and they have a tiny, if this little punctate hole stays open, they won't have any issues. If you cut into this and remove this, then you have no residual thing and they end up with a seroma. So I would be real gentle with that, but like basically right here, like as soon as you want it. So you decide whether you want to do Metz and balms or
I feel like
hemostat.
I like the forceps with the Metz and
It's
balms
all about
'cause
what you
the
want
hemostat
to do
seems
based
big
on feeling.
on such a tiny eyelid.
Your patient is super stable.
Okay.
Dr. Alex is now doing an eyelid margin resection, which is going to give us nice, fresh, healthy tissue. We can't actually just sew the eyes closed because the edges of tissue there need fresh margins because you're not under any tension. Like your suture line is hanging out right where you want it. So your surgeon's throw is locking your suture down so it doesn't loosen between your first and second throws. If you don't need it to lock, you don't have to do a surgeon's. And some people just like muscle memory do that with every single one. And it's not like it saves you a ton of time, but it does result in a little bit less suture ending up in your patient to not do a surgeon's. So.
Teamwork.
Yes.
We made it happen.
Is this your first time doing a cat?
On a cat, yeah.
Wow.
It is. It's
amazing.
the teeniest, tiniest little eyeball I ever did see.
Do you want to hold that up and show?
Yeah, except we'll actually look better against the blue. There's our eyeball.
Can we name this kitten Winky?
That's a good idea.
Classic. Tiddlywinks. Dr. Alex just finished up this surgery. We had to remove this little kitten's left eye. It was painful, it was not visual, and she should feel better like already. And Alex did almost the whole surgery and she did a fantastic job. And we named this kitten Winky because she only has one eye now. She's doing great. She does still need to be spayed, so we'll have her here in our hospital until she's fully recovered from her eye surgery and stable enough to go under anesthesia again, but she did great.
Oh no, there we go. There's her little lack of eyeball now. So this was my first time getting to do an enucleation on a cat. I've done one on a dog before, but that's it. And I've seen a lot on horses and gotten to like help, but really doing it myself, this was my first one on a cat and it was teeny tiny and this eyeball was in really rough shape. Honestly, it literally did explode on us partway through. It was like we barely touched it and it exploded. So that was exciting and definitely confirmation that this eyeball really, really needed to come out of this poor little kitten's head. So I am super thrilled that we got to get it out and help this little kitten feel better. She can live a long, happy life as Winky the one-eyed kitten. So yeah, definitely made for a good learning experience, and I'm super happy that now this kitty's gonna be feeling better once she wakes up. So we have this fair out here today, and we got 8 horses on the list that we're getting done today. We got Pistola Sparks getting his feet done, and we're about to go get that next one here in just a minute. So we have dual peppy checks right here. We've already gave him a little bit of Doran, but he's still pretty hyper and going pretty hard. So we're just gonna see about getting him some more medicine so he'll stand really well for the farrier. Yeah, this is the baby. That was his baby.
All right, so right here, this heel, or this foot, the heels are pretty underrun on it. So most of the time on a trim, we don't really want to take the bars because the bars are going to kind of protect the foot and keep him up off the ground. That way his sole doesn't hit the ground. But in this case, since his heels are so underrun, by cutting the bars, we can actually let the hoof grow out instead of pulling back into it. So that's essentially what we're doing right here. And he's going to, of course, we're going to level the foot up and everything, but hopefully next time we'll get better and better with it, and we'll get this horse back to where he needs to be. They're flared out big time, and so we're going to work on getting him kind of stood back up and his toes rolled back down, and overall get his breakover point moved back a little bit so that way he travels better. You just like it more.
You don't like my sharp ass?
I'm sharp enough as it is.
Are you not?
He done pretty good. He has been sedated pretty well because he didn't want to stand, but he's looking good and we're going on to the next horse. Why are we so far away from the fan? All right, well, come on. Let's go over here. I'm hot.
We're gonna go by the fan.
I'm trying to keep you cooled off.
Unfortunately, we have to go where the horses are.
Well, I mean, you're the one doing the feed. You tell me where to go. So I got Nida right here. We are getting her feet done. I've worked with her a few times. We went out actually this morning and rode her in the pasture before it got too hot. And she actually did pretty dang good. We walked and trotted a little bit, ran around the barrels, and she done pretty awesome. She's very willing. I think she's going to be a very adoptable horse. It's okay.
She's a little so-so on her back legs, but...
You wouldn't let her hurt you anyways. It's okay. It's okay. It's okay, good girl. Whoa. Whoa. She did pretty good on her front feet, but her back feet, she's kind of giving them a hard time, and I don't want to hurt their back and make their job any harder, so we're going to give her dorm and grab another horse and come back to her in about 20 minutes.
Okay, we've got Vesta coming out now. She is next.
Vesta, we just did her feet. We just did a regular trim on her. Whenever she left, I'm satisfied with what we did today. She was missing some quarters, so that's something, we can't really put it back because it wasn't there to begin with. But we can do everything we can to ensure that next time it will grow down and her quarters will grow the rest of the way out. And so that's ultimately what we want to do with everybody here. This horse right here actually has pretty good feet, but anytime they're missing anything, we want to get it as shaped up as good as we can so that way no cracks or anything start to form, and get it to where we can start getting them back to where they need to be and get the hoof wall grown out and get everything back to how it's supposed to look. My mom sees me, she's going to make so much fun of me. I'm dreading it.
You know what? That's what moms are supposed to do.
No, it's not, because it's not fun.
I do it to my kids too.
Well, it's not fun.
Well, it's not supposed to be fun.
On behalf of your children, I think I can speak and say that we don't
You
like
don't
being
have no clue about
embarrassed.
putting my kids through.
Do it?
I embarrass them all the time, and
I got you.
that's the best part of having boys.
Dino, I don't have any more snacks for you. You don't need to come with us, Dino.
Did you want to
Let me grab you, Dino.
Oh, you're so
Back
cute.
up.
You're such a good
Back
boy.
up.
Come on, Cowboy.
We're going to bring him back, okay? Promise.
Good job.
Not leaving him for
He's away. My friend. Here you go, bud. Dino. Hey.
You're such a good friend.
You got a treat.
He is a good
Oh, there we go. So clinical history, he's like 24 or 25. He's a long-term resident.
Okay.
He's had just routine annuals. We picked up a heart murmur, I want to say in like February.
Okay.
So, but he hadn't really had auscultation for a whole year. So
Okay.
heart murmur
So he
in
coulda had it
February.
the whole time, yeah.
Could have had it the whole time, but he's been a resident, has been here. Like I personally have listened to this horse. So this
Okay.
murmur is not 10 years in the making.
Got it.
Dr. Gina did an ultrasound and identified what we believe to be like maybe some mitral valve regurg.
Okay.
And let me go grab my computer because we sent the case stuff to Tennessee Equine, and they were
great,
like,
okay.
you should have a specialist do a cardiac ultrasound. But then they were like, our ultrasound is really old, so like maybe bring yours. And we were like, we're just gonna wait for Marina. So
Or find a cardiologist, because that's different. But anyway, yes, we're going to do it. Didn't say I was a specialist in the heart, but I am a specialist.
Yeah, oh yeah.
So,
do you want me to introduce her, because she's been here before?
I mean, I'm trying to become okay with it. It's just like, I haven't had enough coffee yet. Oh yeah, okay, I feel better.
We have some coffee. Okay.
It's one of my favorite people on the planet, so I'm trying to just let that.
Wonderful.
No, it's true.
Dr. Marina is a boarded zoological radiologist. Were you the world's first zoo radiologist?
Well, so technically I'm boarded in veterinary radiology because there is no zoo radiology
Got
boards.
Got it.
Maybe in 100 years. But,
Yep.
So thank you for asking. That's
I should have
ridiculous.
I should have reviewed your
No,
CV.
Overly flattering.
Wait,
sure.
I'm not completely finished. So,
Okay,
Dr. Marina is amazing with marine mammals. So she has all of these incredible experiences with dolphins. She just helped save a beluga whale, the first successful whale surgery. We're utilizing her because she's local, and we're excited for her to look at Cowboy's heart and help us decide exactly where the disease is in his heart, if any, and kind of stage where we are. And then from there, we need to decide whether or not we need to do any interventions. You can do
so
that
we're just going to need a bunch of alcohol and gel.
I feel like we can unplug it.
Oh,
It's
it
just-
is. It
yeah.
is. I think she has it just hovering.
Yes.
That's a great color on you, Dr. Lydia.
Thank you.
I mean, I'm just saying. So the stuff that I looked at, look at this beautiful braid. The stuff that I looked at yesterday in regular size horses was like most of it is right parasternal long axis, even to look at the left side.
Okay.
But because it's a mini, I mean, we're going to look at both sides. I just had forgotten because I hadn't worked on horses in such a long time.
Yeah.
That most of your high quality views are going to be from the right side. So we'll start here and just see what we get.
Great.
We're just, I'm just gonna. If somebody could have like a little hand towel, that would be amazing because I'm invariably always covered in goo.
Yes.
And then I have to touch the ultrasound.
We
and
have
I don't
them.
wanna.
We
I'm
have
like
them.
that person with a hand
How
towel
is
in
the
back
lighting
pocket.
in here? Is it okay? Because we can do like a lamp and then kill the overhead lights.
We shall see.
Okay.
Thank you. Thank you, doctor. Thank you, Nicole. All right, great. Oh yeah.
And I have a new one in here.
Okay, great. I was just gonna say we're gonna definitely need more than that.
We have a lot.
No, I'm that person. I'll squeeze that toothpaste tube for a year. You know what I mean? People are like, just throw it out. I'm like, I refuse. All right, so we're gonna flip this around.
That beautiful image.
It's not yet, Lydia. I haven't done anything yet.
I mean, compared to.
I'm just trying to get a decent quality image first.
So beautiful.
It's okay. It's just okay. But nope, I don't want that. This is called TGC, is time gain compensation. And so you can adjust how bright it is at different depths.
Oh.
Depending on your image.
We didn't learn this. You probably taught me this fun trick,
It's okay.
and I didn't remember
I'm just
it.
pushing on him and he's like going away. Don't go away, my lovey. This is like when I push on the dolphin and they're in the water, they just float away and you're like, no, I'm trying to get contact.
Hard-boiled eggs.
Stay with me.
Hard-boiled eggs.
They absolutely are. Okay, so yeah, just because thank you, his leg is perfect. So if you know you want to get a video, which I don't want of this, I'm just ignoring what the picture looks like right now, you freeze unfreeze to start the counter over. Once you've captured whatever it is you want within 0 to 1,000, then you go, oh, I love it, and you hit the cine loop button, and that saves a video.
Because it records the previous 1,000 frames.
Correct. Come on. Did you develop this software?
Yeah, I think we knew that. I think Gina knew that.
Gina knew that.
Great. Oh, that's aortic root. Okay, that's much better. All right.
Whoa, look at that.
Okay, so it's okay. I'm trying to not be greedy. I got a little bit of lung there, which is in my way.
This is shelter medicine.
Okay, go ahead. I know. Freeze, unfreeze. Good. And then just keep your finger near that little video loop, and we're going to catch it. Go ahead. Boom. Beautiful. So we'll just do that a couple times, and then we'll put some, we'll probably look at it in short axis, and then we'll put some color on it, and then we'll... Okay. You're such a star, Nicole. Thank you for reading my mind.
She does that.
It's very helpful.
Every time I'm like, hey, Nicole, we should do this, she's like, I did it yesterday.
Yep,
Here's
that's
the
perfect.
results.
I just said go ahead, and she did the thing. It's like if you play the piano or something, you get muscle memory. It's the same thing with this kind of stuff, with the gel and whatever. You don't have to. It's like Lydia doing. It's like Lydia doing surgery. Do you know what I mean?
No, maybe cat neuters.
In her sleep. Do you know what I mean? In her sleep. Oh no! Right when I hit it. No, it's so funny. It's like you go.
Sorry.
No. You do not control everything about this little schmoopy.
He's very cute.
I'm just gonna give my hand a break. So the first time I ever did an echo on a horse was like 15, 20 years ago. And because most of the views are right-sided, you have to use your left hand, And I just remember like 1 minute in being like, wow, this arm is done.
Yeah.
I'm like, what kind of wuss?
I can't do anything with my left hand.
It was so embarrassing. I was like, oh, I'm so sorry. I just need a 20-minute break. They're like, what? They're like, man,
Got some ice packs?
why don't you pony up a little bit? Like, pardon the pun. I felt like such a wuss, really.
You're the only other person I've heard call an animal a schmoopy.
Oh, I'll do this all day.
Do that.
All day.
Yeah, I think you're the
Maybe I learned it from you.
Yeah.
I mean, schmoopy, muffin,
That was-
pastries. I think what's going to happen is we're going to see this left atrium a lot better. Ooh, let's freeze that and go back. Beep, 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 beep. Look how huge that is. And the proper way to do this is now to use my left hand, but I'm going to use my right and then have you be over here. Okay, go ahead. Thank you.
That's the one somebody wants.
This
I was like, we don't have time to spay it.
You know
right
the
now.
Kiffness videos? The musician who turns cat meows into songs?
No.
Prepare to be inundated by 45 Facebook videos.
Yes.
But that kitten would be perfect for him.
See, this is aorta right here in the middle, but I'm not trying to look at that. I'm trying to look at this. There we go. Oh, there we go. Okay, so let's see if we can put color on this. Even though we don't know how to turn down the color gain, we're still going to put color on this side. Oh, yeah.
That's beautiful.
So it was at 1,000, and once it's at 1,000, it stops recording. So I had to start it over.
Okay.
So now it's like it's going to be recording all this stuff. Anything that happens, I can hit the, yep, I can hit that and catch it. Does that make sense?
Yeah.
So sometimes people are scanning and they're talking, they're scanning and they're talking, and this timed out at 1,000 like 5 minutes ago.
Okay.
And then if you hit record, it's going to record something you did 5 minutes ago.
Got it.
Yeah, so that's very important. It's a very kind of unique quirk of this system, because it records prospectively, meaning forward, not retrospectively.
Which is, yeah.
In a sense. See, we can kind of see the tricuspid in the near field. And we got a bunch of videos, so we can look at those. If we need to, we can phone a friend, just casually text it to a cardiologist, of whom I know several. And I don't know if that English was correct. And just say, hey, what are your thoughts on this here, Because subjectively, that left atrium does look a little bit big to me.
Okay.
But I feel like it's so easy to get fooled by that and say, oh, and then you just change the angle and you go, oh, actually, that's not that bad.
Yeah.
But the valve is a little bit crunchy. That is not medical. It's a little bit knobby blobby, so he could have some endocardiosis there, right? Presumably, that's what Gina was seeing.
Yeah.
Dr. Gina. So we took a look at Cowboy's heart. We got some left parasternal long axis views and some right parasternal long axis views. So just views of the heart from both sides. We got some still images, like single pictures. We got some clips, which are like little video loops, watching the heart and watching especially that mitral valve. And I think we got one nice one of the tricuspid on the other side, which are two of the valves in the heart. And so it's just nice to kind of get that data and then let him rest and kind of recover and do his thing while we sort out looking at the pictures later, maybe doing some measurements, maybe asking for some cardiology friends for their take on it. But that was really the point of the exam, was to try to get some good images, and then we can look at those and analyze those later and see if we can come up with any conclusions.
Yeah, I'm just going to put him in the recovery stall for a minute until he's a little bit less sleepy.
Sleepy.
Come on, sir. I know you're such a good boy. Come on.
All right, Cindy. So I hear Sego might have a home.
Megan came in, she's seen Cody riding Sego, and she fell in love with her, and she knew that she'd be a good fit for her family. And we're just excited that she gets to go to a home. And we love her here at Horse Plus, but she's been here long enough. I think she's learned everything she needs to learn from us to be a good companion. You got pretty pink halter, Sego.
All right, Megan. So what particularly drew you to Sego?
The shortness and the blue eyes.
That's hard to.
I can just throw myself on her and eventually throw him on her. And he's a little bit bigger. I like small horses. I don't know why. I've been wanting her, but I know that she had some things that she needed to make sure everything was okay by vets. And then when she got cleared, which was today, was when I was like, okay, I'm gonna come get her. So, oh yeah, I got 2 horses and a pony, so she won't be alone, that's for sure. And goats running around, so.
She does hide behind someone.
I see that, which is fine. She might get to the point where
She'll hide behind you.
Yeah.
She's never hid behind me. This is the first time she's done that, so.
It's because I'm new.
Yeah.
She's like, I know you.
But Peyton, she will hide. She loves Peyton.
I'm about to say, I know she loves
But
it.
Peyton's like quiet when she works with her, and I feel like that's what she needs. Like, not that you tiptoe around her, but like Peyton's like real like chill.
Well, once she gets used to me, I'm very, honestly, when she gets to my house though, everything's very loud.
She'll get used to it.
She'll get used to it.
Are you gonna smile for the picture? You better not grin. You better not. Is he scared or is he smiling? Bless him. Skeeter. Skeeter. You gonna get her? You gonna get her?
Your mom is a little leprechaun.
We're gonna miss Sego Lily. I just don't like catching her. But once you get your hands on her, she's like, okay. But I think she did good with like other horses because she's only been with horses that are kind of like not as tame as yours. I think her being with some horses that know how to mind will do her some good. Like Legend does good, but he's young. Like he don't know.
Gunpowder, he'll finally come right up to me.
Really?
Oh yeah. I mean, I'm still trying to get a halter on him, but we're working on it. I mean, it takes a long time for a horse to trust you.
Look, you can pet her. Pet her nose.
I promise you, sweetheart, I am almost done. They look good. They're really flared out, but they're really good and solid. Which she's a Mustang. Mustangs typically have good feet, good hard feet, and she does. So that's good.
You can get that flare where it's flared out. You can fix all that though, right?
Yeah. With time, you don't want to take too much at one time, just because you can make one sore.
Right.
But yeah, and it's really not too bad either. Mustangs do, in my experience, which isn't a whole lot, they do usually have bigger feet too.
Right.
So.
Get to eating.
Ooh.
I am giving her some molasses to be just licking it, or it's kind of melted, so she's more eating it, to kind of give her something to keep her mind going while he does her back feet. She didn't want to stand very well, but this seems to be the trick. Let's see, get her licking it again, and then.
You gotta get distracted again?
Yeah, gotta get distracted again. It's okay. You relaxed a lot. Look at me, we gotta wash her mouth.
All the molasses, it's on her arm.
Yeah, it's because her face is touching me, but that's fine for the moment. It took a few minutes to get the back, but after giving her some molasses and some Dorm, she kind of calmed down a little bit. Just took a few minutes. We just finished with Dino, now we're on Cowboy. He's the last one of the day, so we'll be wrapping it up as soon as we're done with him. Cowboy!
Well?
Seriously? He's trying to bite the leash rope, did you see that? Here, put it in your mouth. I'll give you a bit. So we're finishing up now. We've got 8 horses done today.
I think everything went pretty good. Everybody stood good for the most part. We had a couple of little hiccups, but definitely nothing major. And hopefully a couple of weeks from now, everybody will be in a little bit better shape and we'll be able to do it all again.
This is Mahogany. She is a 7-year-old Mustang mare. She does not look like a Mustang to me, but she is a branded Mustang. She came to us through our buyout program in May with a young foal by her side, and unfortunately that foal had a catastrophic injury and we weren't able to save her. But Mahogany has a puncture wound with this mucopurulent pussy drainage. She had this on presentation. We sedated her We cultured it. So we took a sample of the discharge before surgery. We got those results back. We employed some antimicrobials and we sedated her. And I created a new spot with drainage. And we did some in-house diagnostics at the time. And we're able to conclude that this tract goes all the way up to here. And on our ultrasound, we identified that there were just kind of some micro abscessy pockets up here. And in lieu of opening the entire thing, we made a little access point here. This one is fully healed, but you can still feel the scar. And created a second access point down here. I try when I have abscesses, if I can, to debride and close the old tract and create a new tract for drainage. So we got a lot of debris out. Since that time, we've cultured it 2 more times. We continue to have pathogenic bacteria present, so it's still infected, and the antibiotics that we can use keep changing. So we like to use evidence to guide care. And this mare is a great case of why we can't just do a test one time and then keep trying to throw drugs at them. Every time we do a new culture, we have a different pattern of growth and different treatment choices. So she's had 2 different kinds of antibiotics. Dr. Marina is here with us today, and we're gonna try to do some imaging to determine what's going on in there. I know that this is fully underneath the muscle. So there's about 1 inch of muscle on the side of this horse, and the tract is immediately outside the ribs. So the chest cavity has things in there that should never, ever, ever have bacteria, heart, lungs. It is full depth, the whole length. So if this were a superficial abscess, I would put my implement up there, I would do this little thing, and I would just open it. Like sometimes I would open the whole thing, because if this were just skin, no big deal. But it is full muscle. So if I took a scalpel blade and I opened this much muscle, we would have a lot of hemorrhage and a lot of big vessels and a lot of bleeding. And we do have the ability to clamp vessels off and tie them off, but there would be like 40 vessels that would continue to bleed. So my surgical approach needs to be guided by what we can handle. We do have electric cautery here at Horse Plus, but the electric cautery unit that we have that was very generously donated, you can't use near metal, and these stocks are metal. So we would run the risk of electrocution or a fire if we were to employ electric cautery and make a mistake and touch some metal. So utilizing that is out with this current setup. We'd have to do full general anesthesia, which has its own risks. So I need to be very confident as a surgeon that I know how deep it is, where the real problem is. And then once we know that information, we're gonna put together a treatment plan to hopefully find what's going on. Chronic drainage to me usually means there's a nidus for infection, which just means there's something in there. It could be a little bit of a fractured rib, it could be dead tissue, it could be a foreign body. When we first looked at this, I was like, maybe there's a giant stick up there. I didn't find a stick. So we're really hopeful that we can come up with a surgical approach and fix this problem. Already looked super old when we got her. So we have no idea how long ago this happened. It did improve after we like really cleaned it out, but I don't know if that's because I actually did anything or if we just aggressively flushed it enough that we reduced the bacterial load temporarily.
Hello, gorgeous girly. Don't you worry about it. We're just gonna do this like this. It's not even gonna bother you. That's bone. Interesting. This is bone.
Other than the
Well, there's a
abscesses,
piece, there's a thing in here.
Yeah.
So there absolutely is.
Yeah.
There's that. That's something that's a hard object because
Okay.
it's got, oh, now it's, don't do that thing where you slow down. Burp. This whole structure, burp, put it in the middle. It's almost like a cylindrical, layered, like an onion skin
like
kind of a thing.
Or something.
More like
around,
like a
maybe.
lamellar is really like the medical term for
Okay.
that, I think. But anyway, so here, this continues, right? This kind of layered cylindrical structure. And then when we get to here, so this is cranial, that's caudal.
Okay.
Okay, cranial, caudal on the right side.
But that rib underneath looks relatively intact. I'm just trying to see if it's like truly a sequestrum. Then I would have to like rongeur it off the bone, but it looks like it's hanging out up there.
Okay, so now we know this is dorsal, this is ventral. So ventrally down here, this is the ventral part.
Okay.
It goes away from
Which would make sense if
bone.
something went in.
Kind of. So this whole giant thing
Yeah.
is a problem.
We probably just need to take it all out.
Does that make sense?
Yes.
So you see this, it's like, it looks
Shell
like
it out.
onion skin
Yeah.
layers this, and it's a tube. So I'm looking at it in cross section right now. Like this.
Yep.
This thing. But I think the whole thing is a
tube.
Yes.
Correct.
And the tube is oriented
So
parallel
this is-
to
hold
the
on,
puncture wound tract.
Hold on. Down here, this thing keeps going, this thing keeps going. If you want to look at the body, it's still going, it's still going, it's still going. And so it goes all the way to here, the tube, and then let me get you an idea of what that lamellar like structure is in cross section.
Whatever the firm thing is. My money's on a shard of rib, guys.
Yeah,
Like,
it looks like bone.
looks like bone.
Yeah, because a foreign body, unless it was like metal or
Yeah.
something extremely, extremely dense like that, would not be this,
Right.
I don't think would be this dense and this sharp.
And it is literally whatever went up there skimmed the exact ribs all the way up. Dr. Marina identified a very hard foreign object that we believe to be a piece of bone. So we thought we were missing something that's causing chronic drainage. Dr. Marina found it. We know where it is, we know how big it is, we know where it's oriented, and we have a surgical plan. So Mahogany has a lovely personality. She's had some sedation, but Dr. Alex is going to apply some local blocks. So we know where big nerves are, and we're gonna try to numb this area so we can do the surgery standing and keep her from having full anesthesia. And my biggest concern with the surgery is twofold. One, there's a lot of big blood vessels. Like I have a vessel right next to where we're making our incision that's like more than 1 centimeter wide. So we're gonna have to be really careful with where we're cutting. Muscle bleeds a lot, so we know we're gonna have some bleeding, but we're gonna be careful with hemostasis. And then number two, this is an old wound. So this horse got injured last week. We're gonna deal with normal tissue except for an injury. This horse has made a layer of onions of fibrosis and abnormal tissue around a nidus for infection that we're trying to find while being gentle. So we're gonna have to be gentle but aggressive in the surgery. I'm gonna go all the way down to the level of this rib, and then I'm gonna like scoop. Our dorsal extend didn't go above this, right? So if I'm going all the way up to here, and I'm just removing this whole area, I should be
Here's your pictures.
far enough dorsal, yeah? No, I feel good about it, but I'm gonna reposition this guy.
Okay, yeah, here.
Because here, if you let go of it, I'm gonna take a wee bit more of the subcuticular because we know that it's deeper than that. Oh, okay, look, Alex, stick your hand right in there and run up and down, and you can feel a little bit of I just stabbed you again. Straight up this way, you can feel the rib is rough and irregular. Yeah.
So it's lying on top of the
So it's lying on top. So what I'm doing is I'm shucking out this whole little onion in a piece, and then we're gonna dig around in it and see and make sure, but like, I'm right on the rib. So I think as long as I just go deep enough and get this whole little blob of tissue out, we'll get the piece.
What was I just looking at?
Can I stick my finger right there?
Yep.
Okay, so
it feels
I don't feel anything right
No, you won't be able to feel it because it's embedded. It's a little shard of bone embedded in very thick, soft tissue. I don't see it. I don't see any way that you would be able to feel it, you know?
Got it.
Because there's 2 centimeters of muscle or tissue on top of it.
Okay, still?
Yeah.
Okay, but
because it's pretty cranial.
Okay.
To where we are. Do you see this?
Yeah.
That's much, much, much bigger than what I was looking at earlier. And that to me looks like a normal rib up here. Wait, hold on, let me do this. I'm gonna grab that. And then as I slide down the rib, do you see what happens? It's full of, there's chunks in there. Like what I'm worried about is that she has a crunched rib in there with like a sequestrum, involucrum, something like that.
Yeah.
That's associated with that draining tract.
Yeah.
You know what I mean?
That's exactly what it is.
The rib up higher is normal and kind of smooth, and I just got the video of that, so we can look at that later. Comes down and then opens up and becomes kind of expansile and crunchy, and there's pieces in there.
Yeah.
And then I did not follow it all the way down because I just didn't. But I'm afraid that might be.
Well, I mean, I can't remove a rib.
No, of course.
Like, I don't know if there's a surgeon who can, but
no.
Yeah, it's so much.
It's so
inside.
crunchy. Do you see what I'm saying?
Yeah.
So that giant
Yeah.
thing.
Yeah, I see it.
See, and up here the rib is nice and smooth and normal. That's lung, that's lung, that's rib.
Yeah.
And as you move down, sorry, I should point with this finger instead. You get this whole
it's
monstrosity. And then that, where does that go? That goes directly into your wound.
Yeah.
So you have a crunchy chronic rib fracture that's expansile and probably is infected.
Yeah. The whole rib itself.
Yeah.
Yeah.
Yeah, from here.
Yeah.
So that, I mean, you're not gonna.
Okay.
We're not doing a.
I think we have to call it.
Okay.
I'm
sorry.
It does really suck. So we have been operating on Mahogany's side for about 35 minutes, and procedurally, everything has gone very well. We had minimal blood loss. Thanks to Dr. Marina, we knew exactly where we were supposed to be cutting. Unfortunately, we've had a major complication that we didn't identify initially, and that is there's a much larger section of basically shattered rib that looks like the center of the rib is affected, and whether that's, I mean, I suspect it's an abscess, right? Like we were looking for the source of infection. So what we identified initially was this little, like, great, we can take this out. And then what we're looking at now is like removal of an entire rib section. The complicated variable there, besides it being cutting into bone, is that it's the chest cavity. So her heart is immediately on the other side. Lungs, heart, lungs, all of the important things, yes. And even if we were to safely access that, we would be leaving an unprotected area to those very sensitive organs. So these are the cases that we see at Horse Plus. We see the ones that everybody else gave up on. So we always want to give it our all. But we are going to close our incision for today and discuss as a team, not what we were hoping to find, not an easy tiny piece of bone to remove. So we will update you after we discuss further.
So after some discussion, when we had Mahogany in, we did decide as a team that it was not something we were going to be able to surgically fix. So we did decide that the last act of kindness was the best option for her. As Lydia had kind of mentioned, not the outcome we were hoping for, really hoping it was just like a small little piece of something in there that we were going to be able to take it out. But unfortunately, we found that that was not the case. After she was humanely euthanized, we did decide to necropsy that area and just kind of fully open it, see what extent we were looking at. And it was actually worse than we thought, even with the ultrasound. So we definitely made the right call. Pretty much once we started opening up around that rib, we found that the discharge that we had been seeing was actually coming from inside her thoracic cavity. We never did find the like a specific pocket, but it was basically coming from inside, which is not good. And Dr. Alex, who was with us as a vet student, was helping us, and she had kind of started feeling to try and feel the abnormalities in that rib. And she actually started just pulling out pieces of rib that were not attached and were actually inside her chest cavity. This is just two of the pieces we found. There was a third little smaller chunk. At that point, we didn't keep digging around. That was enough to know that this was definitely something we were not going to be able to surgically fix here. And then with that infection on top of it, pretty much we were shocked that she never showed an increase in her blood work with white blood cells, was acting completely normal, never had a temperature. So everything was kind of pointing to this being just like a simple fix. And unfortunately, that was not the case. Again, not the outcome we wanted, but there's no way that was comfortable for her. She was probably just being very stoic about it. Very sad ending to that case. We had high hopes for her. She was a super sweet, sweet horse.
This is such a bittersweet moment. This is one of my favorite ponies out here. I really sad to see her go, but I can't wait to watch her leave.
So we're here with Sego Lily, and the time has finally come where she's going to her new home, and she's about to get on the trailer. And Cody, how do you feel since you've started her since she was not halter trained?
I am so excited that she's finding a new home. She's gonna do great, and I know the people that's taking her is gonna love her.
Cody, what are we gonna do in the morning since we don't go?
We're gonna find us another one to start working and find them a great home.
Sounds good.